So one of the things that we see a lot of is fungal infections, either in the toenail or a lot of time in the skin. And obviously really commonly everyone knows about the athlete's foot. That tends to happen in between the toes there. Generally, when you look at it, you'll see like a white area inside there. It will also feel quite itchy. But the one uncommon thing is when people don't realize you actually get it on the base of the foot. So a lot of the time, the athlete's foot can actually manifest in the arch of the foot here. Now, when that happens, we normally recommend a couple of products. For the skin itself, we always sort of recommend tobediphen. Tobediphen cream is an absolutely amazing cream for fungal infections on the skin and is really, really effective. So we would use that once a day, and you would only use a little bit, little dabs on the foot around the areas, and just spread it in. Now, the other thing that people tend to know about is Lamisil. Lamisil is a product that comes in a cream, but also comes in a spray. People don't realize the spray about them. Spray version is pretty much the best thing to use when you're doing in between the toes. A lot of people will use the cream, but actually it macerates the area and actually could make it even worse. So we tend to say a couple of sprays with the Lamisil spray is pretty much all you need to do. And again, you would use that for 2 weeks or so after treating it. The other things that we have in clinic, particularly for fungal nails, are sort of three go-to products that we use. When you're in clinic, we decide which one to use depending on the type of fungal infection you have. Now, if you have a really thick, heavy infection, we tend to go for Emtrix. That sort of breaks the nail down and it's a lot better. It has the activity. But we use this in accordance with our laser treatments, or we give it as a first line treatment whilst the patient understands what's going on. The second product we use is Exel, where we use for kind of light infections, especially when the nail is sort of starting to detach from the area or is a little bit thin. Exel is great. It uses an ingredient which changes the pH of the nail, which means the fungus doesn't like to live in that sort of environment. The last one is actually called Garewell. It actually has an antifungal in it. So we tend to give this a lot now to very superficial infections, but also ones where the nail is not attaching. So a lot of people find that the nail starts to detach because of fungus or damage or anything that's caused it. We trim the nail right back, and then we ask them to use Garewell oil once a day just to go over the surface area, and that sort of tends to allow the nail to detach. So those are our sort of go-to products for that. Final one is our own products. We have something called Shoe Fresh, which we love. It's a great sort of cleaning agent for the inside of the shoe. You literally just spray it inside the shoes once a day. It has an antifungal and antibacterial in it, so it keeps the nice feet nice and fresh. Obviously, on top of this, we also recommend people to wash their socks in 60 degrees, anywhere that your foot goes. So also in your bed linen, get them to wash their bed linen once a week at least, so that at least you're not spreading the infection. So this is our kind of starter product, start issue, what we tend to advise a lot in the clinic for most people. And that's the way to go. Thank you.